Mesdames and Messieurs. And that's it. I'm sorry, I would love to speak French, but my trial ended up in disaster because nobody understood a word. I think my pronunciation is so bad. Can you understand if I speak a little bit slow? Yes. Well, that's good, because otherwise you would be in trouble. Anyway, I'd like to say a few things first before I get into my presentation. Thank you for having me here. It's a great pleasure to be here. Great pleasure to be in Lausanne, my first time, even though I've been in Geneva many times, because, as you know, our office is there. But because I've been asked to speak about advanced nursing practice and in the face of political issues, I'd just like to say a few words before I get into my presentation. And it struck me in thinking about this that over the last 2 years as president and over the last 4 years as vice president, I haven't found that at the global level there are challenges to advanced practice. In fact, there has been great support for the whole ethos of advanced practice in nursing. I think what we see is at a national level, there are difficulties. There are difficulties in relation to the way it's perceived, the different titles, the education, the credentialing, the standards, and of course, the grading structure and whether people are paid for the work they do. That's different to what I see at a global level. And of course, people don't understand what advanced practice is about. And do you know whose fault that is? It's our own. Absolutely our own. Because what I've found is that people don't understand what nurses do, full stop. They don't understand the role. And we haven't been good at articulating our role. So I'm asking you, because you're the academics, you're the ones who have influence, and you are the ones that can make a change in the way that nurses are perceived into the future. And together with Nursing Now and with the World Health Organization, we have been trying to profile nursing, trying to show what nurses do, trying to show by case histories, which is what people understand at the end of the day. We can give all the statistics we like. We have enough academic research. We have research that could line the walls of every institution. But yet, we haven't been good at articulating our role to civil society or to our other colleague professionals. And let me say that last year I was asked by a journalist, why is it that when nurses seek improvements in their conditions, increases in salary, more nurses, increasing the capacity, increasing the education, they're ignored? And with all due respect to my colleagues in medicine, when they ask for anything, they always get what they ask for. They may say differently. But I thought about it because it's not a question you're asked very often, and it's not a question you have to reflect on. And I said all the usual things. Maybe it's because we're mostly female-dominated. Maybe it's because we're more advocates for patient care. Maybe it's because we spend time researching and education and looking after families and promoting our professional entity. And that's why. And I said, no, on second thoughts, that's not the reason. You know, every day that nurses go out to work, they save lives. But when you ask people, the patients, the relatives, the general public, what do nurses do? They say, well, they care for patients. They give us medicines. They feed us. They look after us. And that's about the height of it. But you never, ever, ever hear people saying nurses save lives. But it's the first thing when you ask what a doctor does, they'll say he saved my life. True, very true. But if I go into hospital, I want a competent doctor. Yes, I do. If he's going to be looking after my brain or my heart or my hip, I certainly want a competent doctor. But I equally want a competent nurse. Because if the nurse doesn't recognise the complications that can occur, like infection, like obstruction, like high intracranial pressure, or like pulmonary embolus, then at the very least, I will spend a longer period of time in hospital. And at the very worst, I may die. So, what I'm saying to you now is, we have only ourselves to blame. You have next year, 2020, the year of the nurse and the midwife. Well, it's the year of the nurse. So, I urge you to profile nursing. Because if you don't profile nursing, my concern is that we will see a push towards a second-level nurse or a practical nurse and a push towards advanced practice. Now, is that what we want? I don't think so. So, when we say for 2030 that we will leave nobody behind in terms of healthcare, universal healthcare, that's what the World Health Organization says. What I say is for 2030, let's leave no nurse behind. All roads lead to heaven. So let's bring everybody together, and you have a duty to do that. And it's because I've been reflecting over the past couple of days that I decided that I would say that before I got into my presentation. We have the right and we have the information to show what nurses do. And I'm not sure if you're familiar with these. 3 of those have been done, 2017, 2018, and 2019. Nurses a Voice to Lead. In 2017, it was for the Sustainable Development Goals. For 2018, it was Nurses a Voice to Lead, Health is a Human Right. And for 2019, it's Nurses a Voice to Lead, Universal Healthcare, Health for All. All these contain case histories of the great work that nurses are doing all over the world, at all levels of practice. Great, great work. I urge you to read them. I also urge you to portray the case histories that are being done here in Switzerland. That's what makes a difference when you're talking to your politicians and when you're talking to your colleagues. So if you don't remember anything else, in the time that I'm speaking to you, please remember that. And now I'll go ahead. Oh, but first, by the way, who's keeping time? You are. 2 minutes from the end, let me know, because I tend to get carried away and tell stories. So, anyway, just about advanced practice, because I'm a great advocate of advanced practice and have been for over 20 years, pushing it in Ireland, pushing for, because we knew that it was needed. It was needed for various reasons, and for people who had, I suppose, were most in need of care. You had the elderly, you had mental health patients, you had patients in the community, you had patients in all sorts of areas. And of course, we had a lot of people in orthopaedics. And the reason I say orthopaedics is that last year I broke a metatarsal bone, a fractured metatarsal bone in my foot, and I was heading to Jordan. And so I went in and I met an advanced practitioner nurse who looked after me. She told me what she thought it was. She had me x-rayed, confirmed what she said, told me I could wear a boot, had me practice in the boot, which I think sometimes doctors don't have time to do that. And that's important because, you know, it's kind of you roll with the boot. So that was important, particularly as I was traveling. And then told me exactly how long it would be on, what I should do, and gave me a number to ring if I was in trouble. I didn't see a physician in the whole time that I was treated. And that was great because I knew that I could ring if I had problems. A year later, I fell on the same foot and I had an x-ray and I asked them, and although it didn't show up anything, they said, well, just in case that we haven't seen, there may be a slight fracture in the same area, but we can't tell. What you should do is really wear the boot for another week or two, and then, you know, if that's okay, get rid of it. If it's not okay, come back to us. Worked. So I'm very happy with advanced practice, believe you me. So that was the story about my advanced practice, because I firmly believe in advanced practice. Oh, we're going the wrong way. Okay, how long have we been in existence? 120 years, ICN has been in existence. And we're very proud of that fact because it started out with these 4, 5 ladies looking for equality, looking for the vote for women. That's what they were looking for. They weren't thinking about nursing at the time. And they met colleagues in America and in Germany, and it started with 2 ladies in London. And they decided, because they were nurses, the best thing to do was to at least share information across the globe, try and improve the standards of nursing, try and improve the education and the professionalism, and try and improve the socioeconomic welfare for nurses. That's what they started out to do. And then to become the global voice of nursing. Not much has changed today because we still have the same ethos, we still have the same mission, and we still want to do the same things. This is where we are, 130 countries. All the red is where ICN is. We'd like it to be all red, not just orange. And one of these days it will be, but a lot of those countries have a difficulty. When you have a good association, be very thankful for a good nursing association in country, because a lot of countries are really, really struggling to have a good association to represent them. And it is important when you're facing political challenges in country. 20 million nurses worldwide. Oh, wrong one again. These are some of the people that we work with. These are some of our partners. And when you're working, and one of the things that Lord Nigel Crisp said to me when he was setting out on the Mission with Nursing Now campaign, and he said, nurses have to stop talking to themselves. It's in my brain. It has never left my brain since he said it. And it's true. We spend our time talking to ourselves. We're already convinced. What do? But we need to convince other people. So let's stop talking to ourselves. So it's nice to see other people here. So we work with a lot of different people, the World Health Organization, the United Nations, the International Labour Organization. We work with the United Nations in relation to the Commission on the Status of Women. We work with Women Deliver. We work with the NCD Alliance and the Commission on NCDs. So we work with a lot of different people, and you have to. You have to be with other groups if you want to make any political influence or impact on healthcare at a global level. This is Singapore, and this is Dr. Tedros, the Secretary General of the WHO. He is a great advocate of nursing and of healthcare because he comes from Ethiopia and he saw what nursing could do in his own country, and he saw the value of it. And as far as he's concerned, he says that universal healthcare will never happen without nurses. The SDGs will never be implemented without nurses. And his comment is, countries that do not have enough nurses are trying to provide healthcare with one hand tied behind their backs. That's his comment. And he has worked with us on a whole lot of different areas, on universal healthcare, on primary healthcare, on vaccination, on NCDs, of which I'm a commissioner at the moment on the NCD Commission. And of course, he was instrumental on campaigning for 2020 to be the year of the nurse, because usually you have a day. A day is allocated to different healthcare entities, but this is a year. So make the most of the year. This is Students' Assembly. Are there any students here? Oh, good. I'm delighted to see the students here. We don't give enough credit to the students or bring them into our political arena. As you know, I don't know if you realise that Nursing Now is campaigning for a Florence Nightingale challenge in relation to 20,000 nurses to be educated as leaders. And it's almost halfway through now. They have countries all over the world supporting the campaign. But the students and the young nurses, we have to bring them into every area of politics, practice, leadership, because it's their future and they are our future. And their, I suppose, courage, their tenacity, their enthusiasm, we need with older people's experience. But we need both. So I'm glad to see you here. You all know this lady. You are never too young to make a difference. She has a book of all her speeches, and that is the title of the book. People have criticised her because she's young, or because she has Asperger's, and for various reasons. And she says Asperger's is a gift because they become focused, very, very focused on one issue. And so she has. And the reason that I bring her up here is that I do believe, when I look at our young people up there at the back, that they are never too young to make a difference either, and every individual can make a difference. ICN's ability to make a difference. This, as you can see, I don't know if you can see me, but it's a big, big room, and the yellow arrow there is me, among a lot of very high-profile people. Not an easy seat to be in, believe you me, because everybody has their own agenda when you're talking about NCDs, and it's a lot about treatment, and it's a lot about antihypertensives and statins, and it's a lot about taxation, all true, and it's a lot about ensuring that you have publicity to say how bad cigarettes are and how bad alcohol is, and that you try to teach people all of this. All good, all true, and I believe in all of those. But sometimes I watch television and it says all the things you should do, and I kind of fall asleep. So my fight is to say that the health workforce have a huge part to play in NCDs. All our health professionals, doctors, nurses alike, but more so in public health and in primary health care. Because by the time people get to hospital, to me it's too late. You have to get in there early, and we don't invest enough in primary health care or in public health. We used to do years ago, not anymore. Everything is now in treatment, in tertiary care, and in the last 5 years of life. That's where the money goes. We, all of us, all the health professionals have a right and a duty to change that. The second part of that is due out probably in December. And I'm happy to say that the health workforce are in there, and the fact that they should be working in relation to prevention, health promotion, early intervention. And that's where that's where advanced practice and all the nurses can play a huge, huge role. I'm not going to read it out for you. You can read it for yourselves. We are cost effective. We are efficient. And we can deliver. I'm leaving you to read. I don't believe in reading for anyone. That's the biggest issue. Building capacity in the workforce. In high-income countries, we think we're badly off. But you go to low and middle-income countries and you just see how badly off they are. There is no comparison. I was in China last week, 2 weeks ago. 1.3 billion people, 4.5 million nurses. They could double that and still not have enough. The World Health Organization says that we are short by 2030, 18 million health workers. Half of those are nurses, 9 million. That's how short they are. You can double and triple that is how many we need. Because if they need 4.5 million at the very least in China, and in America, because of the retirement age, they'll probably need 1 million. That doesn't go next hour near the 9 million that's required. In Africa, if you go to the very poorest of the poor, South Sudan, they have no money to pay the nurses. The nurses are working for free, as are doctors. because there is no money. A lot of the African countries, they need the nurses, but they're not being employed. So in order to keep up their skills, they're going to work for nothing. Or else, if they're from the English-speaking countries of Africa, they're leaving. Where are they going? Over to Europe. And you know, I believe that there's an ethical issue here. Because we are recruiting, and I say that about Ireland, and I say it about England, and I say it about the countries that we're all from. We are recruiting from the Philippines, from India, from the countries that need those people most. Of course, the governments are glad to have them leave because they're sending money back to the country. But there's something that our countries should be doing too. We should be supporting them to go back to their countries. I do believe that everybody has a right to go and make their living and to make a good living, but I don't think that we should be aggressively recruiting from countries that need their people. And you know, I would be one of the first to say that everybody from Ireland went all over the world. We didn't stay at home, that's for sure. But I don't think anybody was telling us, come over. We were going on our own bat. So, it's worth a thought. It's worth thinking about how we do business and how we look at our other countries. And if we're selfish in our thinking, we are busy, we are overworked, there's a lot to be done, but I believe the models of healthcare have to change. This is Nursing Now. You've heard of it. I'm not going to say too much about it. You know the people up there, Lord Nigel Crisp on the right. Middle row, Kate Middleton, who is the sponsor. And we were lucky to have her. 3-year campaign, trying to improve the profile and status of nursing, trying to improve the leadership of nursing and bring them into health policy. Because if we are 50% of the workforce, we should be having a say in how health is delivered. We do know how health should be delivered. We're not quite asked, and I don't believe in sitting around waiting to be asked. I think we have to make our own way there. We have to give our own opinions, and we have a right to do that. "2020, as I said, is the year of the nurse and the midwife. And so, I'm saying to you, what are you going to do about it? You have an opportunity. Either you use it or you don't. You have a duty to use it. You have a duty to tell the world what nurses do. You have a duty to tell the world what advanced practice nurses do. Nobody is going to do it for you. And you cannot blame people outside and say, nobody understands us. Well, they don't if we don't tell them what we're doing. So I'm putting it to you, as I put it to everybody that I meet throughout the world. I've got 5 minutes. Is that what you're saying? That's okay. Leadership, you know, we have been running different programs, and leadership is very important. In all areas of healthcare, we need good leaders. And, you know, we shouldn't be just dependent on people, with all due respect to the people who draft policy. They're not the ones delivering the care. And it's the people that are delivering the care that understand the models of healthcare that are required. You know it, I know it, and everybody else knows it. So please make your voice heard. Our lifestyle and environment. Oh, one big one for us, one that I'm very interested in. Yes, we're all getting lazy. We're all getting obese, and I say that for myself. Mind you, you look very smart, so you're all right. Smoking, drinking, everything that doesn't help our lifestyle. 75 to 80% of all deaths are from NCDs and mental health. 40 million people, the people in the age group of 39 to 69, those are the working population. So we should be worried about it. It has overtaken all other diseases, including infectious diseases. NCDs have outrun all of those. And we will not be able to afford health care unless we do something about NCDs. They're a pandemic getting worse. And I think this is where nurses can make a huge impact. And we have seen it in a lot of countries in relation to advanced practice, in relation to setting up primary health care clinics, in relation to screening, in relation to all of those areas. You have a huge role in this area. Please, please take it. Premature deaths. Low and middle income countries do the worst out of this because they will get NCDs, cardiovascular disease, diabetes, respiratory disease 20 years earlier than anybody else. In Tonga and in places in the Pacific, the amount of amputations is unreal. Unbelievable in this day and age. And it's through lifestyle, and it's through coming too late to look after their diabetes. They have started having specialist nurses in diabetes, which has cut down on the amputation rate. These are nurses all over, doing different initiatives. As I said, you can read them in the International Nurses' Day Guide, and you can submit to those for this year, for 2020. These are places where advanced practice is working very well. Indigenous people in Australia have 1 minute. These are all great, great case histories. You can read fast. And just to tell you one more story, in Walmart, you know Walmart is a shopping centre in the Appalachian Mountains in the States. They have set up clinics there, primary health care clinics, and they have cut down because it's cost effective, it's low cost to go there. There's nurses and doctors, and they're doing blood pressure, they're taking bloods for blood sugar and all of that. And they have cut down on the number of patients going to accident emergency by 20%. The amount that they will save if they continued is in the range of 4 billion. This is the student nurses in Geneva, and we were delighted. We had 40 young student nurses in Geneva in May, and it's the World Health Assembly. Next year, as you know, in Halifax in Canada, we'll have the NPANP, great conference. It will be supported by WHO, it will be supported by Nursing Now, and it will be publicised very widely. I suggest you do come if you can. The other thing is, did I tell you that we are bringing out a new guidance for, did I tell you? No. I have a half a minute. Guidance for A&P and Ps. The last one we did was in 2002. This one will be coming out in the next month or two. A very, very good document. We've gone to 50 countries for their input from their experts. We have then gone to the nurse practitioners PN network and asked for their advice. And we've had a very good guy, David Stewart, working on it. And it's now going out to the National Nurses Associations for their views on it. And we hope it'll be ready in another month or two. So it is a very good guidance document on education and credentialing, on all the different facets and all the issues and problems and name titles and all of that. So it will be well worth a read. And I'm sure I could tell you a lot more, but I don't want to tax you anymore listening to me in English with an Irish accent. As my colleague in Geneva says, Howard Catton, he says, does anybody understand you? I said, what do you mean? Just because you speak the Queen's English doesn't mean that people don't understand me speaking Irish English. Anyway, merci, thank you.